think we're going to get started, Sophia.
All right.
So welcome, everyone. Welcome to our webinar on fibromyalgia. I'm Dr. Alexis Gopal. I'm the Medical Director of Vitality Medicine of New York City. And this is Sophia. She is our health coordinator and functional medicine coach.
Hi, everyone.
She is co-hosting with me this evening. We're very lucky to have her. So let me get my slides up and we will get started. Okay. Can everybody see the slides? If you could just let us know in the chat box, please, if you could see the slides, and then we'll get started.
Okay, I can see them.
Okay. So again, welcome to our webinar on fibromyalgia. I'm Dr. Alexis Gopal. I'm the Medical Director of Vitality Medicine of New York. Today's webinar is on healing fibromyalgia. And I'm going to tell you a little bit about myself and about my health journey and how I got into functional medicine. Then we're going to talk about fibromyalgia and exactly what is fibromyalgia, what is the real definition of fibromyalgia. And then I'm going to go into the root causes of fibromyalgia and how what my method is to help heal fibromyalgia. And Sophia is going to also take a few moments to tell us, to talk a little bit about her background and her role at Vitality and how she interacts with our clients. So welcome, everybody. Hi, Yvette. Welcome, everyone. We're going to get started because we want to stick to the schedule. It's a little bit after 7, so let's get started. So just a little bit about my background. I'm a native New Yorker. I did all my training in New York. I went to college at New York University, and I went to medical school at Mount Sinai School of Medicine. After that, I trained in internal medicine and I did a residency and chief residency at Albert Einstein College of Medicine up in the Bronx. I practiced internal medicine for almost 30 years. But I later in my career took some extra training in functional medicine and obesity medicine. And what led me to functional medicine, I'll go into a little more detail in a few minutes, is my own health struggles, my own health issues. It was quite challenging for me to get help with my own issues, such as migraines and weight gain and things like that. So I'll tell you a little bit about my health journey. So, I was pretty much always a sickly child. As a child, I had childhood asthma. So, I had received steroids and antibiotics a lot. So, I already as a child, I started up at a disadvantage. Even as a child, I remember being constipated and tired and always sick and always had a rash and just not healthy. And then add to that having the standard American diet with a lot of preservatives and chemicals in the foods, I just was not a healthy child. And that kind of went into adulthood as well. About 10 years ago, as you can see in this picture, I struggled with fatigue, insomnia, weight gain, body aches, brain fog, depression. I'm sure a lot of these things, may resonate with you if you're watching right now. I went to many traditional doctors who all did testing and blood work, and they all told me I was fine. My blood tests were fine. You're fine. It's perimenopause. That's just the way it is, and you have to live with it. Eat less, exercise more. If you want some medications for pain, if you want medications to sleep, they would give it to me, but that was all they had to offer. So, I took their advice. I worked out with a trainer, I counted calories. sleep hygiene, turning off my electronics before going to bed, and really nothing helped. I was up all night, only falling asleep just before my alarm clock would go off in the morning, and it was a very demoralizing experience. And this is, as a physician, it was even more demoralizing because I thought, here I am, I'm a physician, I should know how to treat myself, but even my colleagues couldn't help me. So I felt very frumpy. I lost my confidence. I felt very alone, and I'm sure many of you can relate to that experience. So after doing my own research, I discovered functional medicine. And what is functional medicine? It's basically, it's a different way of practicing medicine. It's a different way of looking at chronic illness. So instead of giving medications for everything, in functional medicine, we look for the root cause of illness and address it at that level. So when I started exploring functional medicine and I started actually working on my own health issues, my symptoms improved or actually, went away. It turns out I had quite a few things going on. I had imbalanced hormones. I had inflammation from undiagnosed food allergies. I had many nutritional deficiencies. And when I corrected these imbalances, it's like I became a new woman. The weight came off. I slept better. The brain fog, the body aches, all of it disappeared. And my mood normalized. So the reason that I actually decided to do functional medicine is because I thought this works so well for me as a patient. I want to bring it to my patients because this is something that not too many people know about. So that's really how Vitality Medicine of New York started. Vitality Medicine of New York, we have an office in Midtown Manhattan and we have an office in Yonkers, New York. And that's how Vitality Medicine started. It started because there's so many men and women that are suffering from chronic illness and not getting better with traditional medicine. I felt a calling to bring functional medicine to these people. To show them that there is hope. There are things that can be done. So that's kind of a little bit of how Vitality Medicine of New York got started. So, one of the most common things that I see in my office is fibromyalgia. And one of the most common reasons that people seek me out is for chronic pain and fibromyalgia. I thought this is such an important topic to talk about because A, it's so common, and B, when people come in with fibromyalgia, I notice a couple of things. One is that they all seem to be very resigned that this is going to be a lifelong condition. There's no cure, and they have to live with it. And they also seem somewhat demoralized. It's like they're resigned to a life of pain. And discomfort and insomnia and all the other symptoms that are associated with fibromyalgia. And interestingly, when patients come to me and I do an evaluation and nobody ever comes just with fibromyalgia, it's, there's always other things. There's always GI symptoms. There's always sleep disorders. There's always other things. It's never just pain. But the interesting thing is that when I do an evaluation and I find the root, all the underlying issues that are going on and we treat them, it's interesting, the fibromyalgia gets better. And that is what is prompting me to do this webinar because there's many people out there suffering and they may be suffering unnecessarily. So what exactly is fibromyalgia in the first place? Years ago, when I first started practicing, the way we diagnose fibromyalgia is you had to have 11 out of 18 tender points on your body. So there were certain spots on the body that were tender. And if you had 11 out of 18 of those tender spots, that's how we made the diagnosis of fibromyalgia. There was no blood test and there's still no blood test. It was more diagnosis of exclusion. So what is fibromyalgia? According to the American College of Rheumatology, fibromyalgia is actually a neurological condition. A lot of people think it's an inflammatory disease or an autoimmune disease. It's actually a neurological disease. It's a disease in the brain where your pain is amplified. So, if your brain is like a radio, the volume is turned up too high when it comes to pain. And it's associated with many other symptoms like fatigue, insomnia, brain fog, depression, anxiety, migraines or tension headaches, digestive issues like irritable bowel or reflux. It can be associated with an irritable or an overactive bladder, pelvic pain, or TMJ, which is jaw pain. Fibromyalgia is not an autoimmune disease. It's not an inflammatory disease. It's not a joint or muscle disorder. It's a central pain amplification disorder, meaning that the volume of the pain sensation in the brain is turned up too high. So a true diagnosis of fibromyalgia is a brain disorder where you feel pain more than somebody else would that doesn't have that pain amplification disorder. It affects about 2 to 4% of the population. It's more women than men. And there's no cure. Symptoms are usually just controlled with medications like Cymbalta, Savella, or Lyrica, and gabapentin. These are anti-epileptics. Some of these are antidepressants. And basically, the only treatment for fibromyalgia right now, currently, is exercise and medication. So how do I approach fibromyalgia? What's the functional medicine approach to fibromyalgia? Well, just like with everything else, we look for the root cause. What's happening at the cellular level? What's happening at that level? And by addressing those root causes, we're not only are able to help people get relief from fibromyalgia, but many other things as well. And I'm going to go into more detail on the root causes of fibromyalgia, and you'll be really shocked how many root causes there can be for fibromyalgia. But before I get to the root cause and talk a little bit more, I just want to introduce my health coordinator and functional medicine coach, Sophia. And she's going to talk to you a little bit about what she does, her role at Vitality Medicine. And I'm going to turn it over to Sophia.
Hi, everyone, again. My name is Sofia Gravania, and I'm the health coordinator and one of the health coaches at the Vitality Medicine. To give you a little bit more information about myself and my background, I graduated from Institute of Integrative Nutrition as a functional medicine nutritionist and health coach. And I am highly motivated because I've been through my own challenges with my health. I've gained a lot of weight over the years, and I've struggled with a very busy schedule, not knowing how to balance work, life, and eating healthy. And I had to go through my own experience to understand how food can really help, and how just creating some changes in your life can truly help with your health. So I decided to join this amazing team at Vitality Medicine, and it's truly a privilege to work with Dr. Alexis Gopal, who has a lot of experience in the field. And what we do here is really life-changing. So if you're looking to really take a step forward and work on your health and just do a few changes, you can really find yourself in such much better place. To give you more information about how the evaluation would go, so we start with a screening form, and it looks like this. I know today we're only talking about fibromyalgia, but we can help with a lot of these health problems. So pretty much everything that you see here, from chronic inflammation, problems with insomnia, anxiety, depression, diabetes, thyroid disorders, anything that's food related, from food sensitivities, digestive symptoms like gas, bloating, heartburn, irritable bowel syndrome, as well as hormones. So if you're having any problems with eczema, acne, migraines, including fibromyalgia, of course, we could help with everything related here on the screen. And the way we do this is we're starting with an evaluation. It's a very detailed evaluation so we can get to the root cause of the problem, right? And from there, we can create a plan of care for you. So if you're interested about the evaluation to find even more information about it, I could help you with that at info@vitalitymednewyork.com. So that's medny.com. You can also find more information on our website, vitalitymedny.com. That's a phone number there as well where you could call and ask for me to schedule a 15-minute free conversation where I would guide you through the next steps, and I would explain even more what functional medicine is, how the evaluation would go again, like what are the next steps. So I'm looking forward to talk to all of you and offer more information about this. So if you have any questions, please type in the chat and I will get back to you. Or again, use the email and I will answer as soon as possible. Thank you.
Thank you, Sophia. Okay, so what are the root causes of fibromyalgia? Well, it's a long list. So I'm going to go through the list with you, and you're going to be shocked and amazed at how many things are really underlying fibromyalgia. Some recent studies have come out showing that there's a possible connection between thyroid hormone resistance and fibromyalgia. So what does that mean? So thyroid hormone resistance, you have a normal amount of thyroid hormone, but the receptors in your body are not responding to the hormone. So even though you have a normal amount of thyroid hormone, it's not having its intended effect. And when you have thyroid hormone resistance, you can get chronic pain. You can get a lot of the symptoms associated with fibromyalgia. That's a relatively recent finding. There's a lot of studies that have just come out, and they're exploring high-dose thyroid hormone as possible treatment for fibromyalgia. So what else? What else can be behind fibromyalgia? Chronic occult infections. And what does that mean? There are many people walking around with tick disease, things like Lyme disease or babesiosis or ehrlichiosis, infections like Epstein-Barr virus, that's the virus that causes mono. Some people get that infection chronically and it doesn't go away. Bartonella, which is another infection. So there's people who have these infections that have gone undiagnosed and ultimately develop chronic pain and fatigue and many of the symptoms that are associated with fibromyalgia. And by testing for these infections and treating them, many of the symptoms of fibromyalgia can actually be reversed. Nutritional imbalances. Nutritional imbalances can certainly be associated with fibromyalgia. I can tell you that vitamin D deficiency, the three things that people tell me when they are low on vitamin D are it's always the same three things. I'm achy, I'm exhausted, and I'm depressed. And when we correct their levels and get them to a good vitamin D level, those symptoms get better. Toxins are a really big one. We're all exposed to toxins, through food, through chemicals in our foods, through toxins in our environments, pesticides, plastics. It's interesting about plastics, people think that just because our plastics now don't have BPA in it, there's still toxic substances in plastics, phthalates. Phthalates are used because they took the BPA out of the plastics, they had to replace it with phthalates. And those are actually even more toxic than the BPA. So plastics are really toxic, pesticides. So where are these toxins going? They're stored in our fat layer in our body, and they leak out every once in a while and cause pain. They can cause headaches, they can cause fatigue, they can cause digestive issues. So toxins are definitely a root cause of fibromyalgia. Mold illness. 50% of our buildings in this country have had some form of water damage. So chances are you might be living in a building or a home, or you may be working in an office that has water damage and has mold growth. Now, in most people with a normal immune system, you're able to fight off those toxins and eliminate them. But there's about maybe 25% of the population has a genetic defect where they can't detoxify those toxins from the mold. And in this population, they can get mold illness, and some of the symptoms of mold illness are identical to fibromyalgia. So if you live in a building with water damage and with mold, and you have fibromyalgia symptoms, they may be related. Okay. It's very well known that physical or emotional trauma can be a root cause of fibromyalgia. Many people who have fibromyalgia actually developed it after some kind of a physical trauma, an accident, a motor vehicle accident. They find that afterwards, for some reason, it triggers chronic pain. And even emotional trauma has been associated with fibromyalgia. Mast cell activation syndrome is a condition where mast cells release histamine, which is part of the allergy response. And in mast cell activation syndrome, there's an over response. So patients with mast cell activation syndrome are actually very sensitive to everything. They have multiple allergies. They have sensitivities to the environment, to chemicals, and they present with most of the symptoms of fibromyalgia. So that's a condition that has to be excluded before you can diagnose somebody with fibromyalgia. HPA axis dysregulation, that stands for the hypothalamus pituitary adrenal axis. Those are the glands that control cortisol, which is our stress hormone. So, chronic stress causes an overreaction in the brain. So people who have a low pain sensitivity, it could be related to excess levels of cortisol. So that type of hormonal, issue can lead to the symptoms of fibromyalgia. Gut issues, definitely. I would say probably 99.9% of my patients who come in with fibromyalgia also have gut issues. They all come in complaining of bloating, either constipation or diarrhea, irritable bowel, reflux. They all have some kind of a GI issue. And studies have shown that imbalances in the microbiome or the bacteria of your GI tract, those bacteria produce substances that can lead to chronic pain. So that's a really, really important root cause of fibromyalgia. And immune dysregulation. The majority of our immune system, believe it or not, is actually found in our gut. So if you have microbiome issues, if you have gut issues, chances are you're also going to have immune dysregulation, which you can also find with some nutritional imbalances. And with immune dysregulation, again, you get a lot of symptoms of fibromyalgia. So I think the point I'm trying to get across is you really cannot be diagnosed with true fibromyalgia, the neurological disorder fibromyalgia, unless other things have been excluded. And I think most traditional doctors, they'll exclude thyroid disease and maybe even vitamin D deficiency. But a lot of these things are not looked at. I don't know of anybody who tests for mold illness or occult infections. They may check for inflammation. They may rule out things like rheumatoid arthritis or autoimmune disease. But I think the majority of the things on this list, are not excluded. And I think that's one of the reasons that our patients get better when they go through our treatment. When I say get better, I mean their fibromyalgia symptoms go away. So what does treatment entail? So the one thing about the way we practice at Vitality Medicine is we're very holistic. So, we address everything. So if you come to us with a variety of different things, we're going to address all of it because they're all interconnected. If you're having depression, anxiety, sleep disorder, those are brain issues. Well, they go hand in hand with gut issues. So you can't treat one without treating the other. So we have a very holistic approach, which is a little different from traditional medicine, where they address one issue at a time. And even other functional medicine doctors, there are some functional medicine practitioners that are, they practice very fragmented care. So if you present with fibromyalgia, they're going to focus on one thing. They're going to focus on pain. They may not focus on gut issues or anything else. So our treatments, we start out by repairing the gut because oftentimes the gut issues are underlying many of the symptoms of fibromyalgia. So if you have leaky gut, we can give you all the vitamins in the world and all the hormones in the world. If you're not absorbing them because you have leaky gut, you're not going to get better. So we start always by repairing the gut. We have a special protocol, and our coaches assist us with our patients in helping them get their gut repaired. Correct the microbiome. If there's an imbalance in the bacteria of the gut, we strive to correct that imbalance. Correcting nutritional imbalances is also extremely important. I'd say the majority of my patients have a B12, zinc, and vitamin D deficiency. And definitely those deficiencies can lead to symptoms of fibromyalgia. So, after repairing the gut and making sure that you're able to absorb your nutrients, we make sure that we give you those nutrients and get them back to optimal levels. The next thing we do is detox. Okay, or if you recall, I said that toxins are stored in our fat layer and leak out periodically and cause chronic pain, headaches, fatigue, and many of the symptoms of fibromyalgia. Toxins are stored in our fat layer, and they just sit there dormant for years and years and years. We all have things in our fat layer from years ago. Things that we were exposed to years ago are still sitting in our fat layer. So how do we get it out? We have to convert those toxins from a fat-soluble form where it's just stored in our fat to a water-soluble form so that they can be eliminated through our breathing, through our skin, through sweating, through urination, through defecation. That's how we get those things out of our body. And we have a variety of techniques that we use to detox our patients. We use infrared sauna to heat up the fat layer and get, your body to sweat out the toxins. We use IVs, a combination of IVs and injections to help the body mobilize those toxins. We use a special diet and special shakes that have binders to help bind toxins in the gut, and so that way you could excrete it. So this is part of our protocol to help not only with fibromyalgia, but also with many, many other conditions, as Sophia showed us on that questionnaire. This helps with many, many other chronic illness as well. Treating occult infections is key to treating fibromyalgia. If you have an underlying tick disease like Lyme disease, or if you have Bartonella, or if you have any occult infection, it has to be treated before you can get better. I've picked up a lot of cases of Lyme disease, people who were not even aware they had it and didn't realize why they felt so terrible. They had gone years and years undiagnosed. Nobody had ever picked up that they had Lyme disease. So it's really important that those occult infections, those hidden infections, are treated. Hormonal imbalance, that's a huge one. I mentioned high cortisol. I mentioned the cortisol issue affecting the brain and making you more sensitive to pain. But there's many, many other hormonal imbalances that can lead to a lot of the symptoms of fibromyalgia. You know, having an imbalance in testosterone for men, having an imbalance, having estrogen dominance in women where they don't have enough progesterone to balance out their estrogen can cause many of the symptoms of fibromyalgia, including chronic pain and insomnia and fatigue and depression and anxiety. So balancing the hormones is key, a key part to improving the symptoms of fibromyalgia. Stress management is huge, and this is something that's very much ignored for the most part. You know, stress management is very important to get your cortisol levels under control. And you know, everybody, this is not negotiable, and it seems that this is more of an issue with women than with men. Women seem to always be taking care of everybody else, but don't take care of themselves. But self-care is not negotiable. So every day, I really ask my patients that they find at least 30 minutes to do something that brings them joy and to bring down those cortisol levels. And this is something that's not negotiable. It's something that really has to be done every day. And I think it's one of the most difficult things that I find that patients, you know, trying to get them to comply with this is very difficult because, you know, people feel like it's frivolous to take the time to take care of themselves that way, especially women. So this is very challenging, and this is very important. You have to find something that brings you joy and do it every single day. It's crucial for your health. So in summary, you know, I just want to, you know, just kind of tie it all together. The treatment for fibromyalgia has to be holistic. You know, just focusing on one thing is not going to help the symptoms improve. You have to look at the patient as a whole. And if there's a GI issue and there's a sleep issue, if you don't address all the issues, the symptoms don't get better. So treatment has to be holistic, not fragmented. The other thing I want everybody to take away from this presentation is that there might be more than one issue causing symptoms. There's no law that says that you can't have, you know, you can't have thyroid resistance and mold illness, or that you can't have a hidden infection and high cortisol. You know, it could be more than one thing going on. And actually, it's usually more than one thing going on. So keep in mind with fibromyalgia, there may be multiple factors involved and that have to be addressed. And that's why it's so important to treat the patient holistically so that we don't miss anything. And many times, the symptoms that patients experience that they think is fibromyalgia is really not true fibromyalgia. You know, fibromyalgia is a neurological disease, is a disease of the brain where, you know, people are very sensitive to pain. But there's many things that mimic fibromyalgia. And so I question whether many of the patients who come to me diagnosed with fibromyalgia actually truly have fibromyalgia if it's not something else that's masquerading as fibromyalgia. So I hope this presentation was helpful. And I'd like to give you the opportunity to ask questions. You know, the reason we're doing this live, you can ask questions of myself, or you can ask questions of Sophia about anything that we've spoken about so far, or we'll take some questions right now. Just type it into the chat box if you have any questions. Sophia, do you have anything you want to add?
Okay, I see a question.
How does the infrared sauna help? That's a great question, Molly. So infrared sauna, unlike the traditional steam saunas, so steam saunas, they heat up the air around the patient. It doesn't really heat up the body. So as far as detoxification, steam saunas are nice because, they warm you up and they relax your muscles. But as far as detoxification, they don't do much because they don't really heat up the tissues. Infrared sauna, in contrast, actually does not heat up the air or the air around the patient. Infrared sauna actually goes and penetrates the tissues into the fat layer, heats up that fat layer, and converts some of those toxins from a fat-soluble form into a water-soluble form, and you're able to sweat some of those toxins out. So infrared, in contrast to steam saunas, it's one of the reasons that we use it for detox. It does help with pain. Many of our pain patients, they find that they feel much better after being in sauna. It's also very relaxing. It's good for stress management. But the true reason that we use infrared is for detoxification, because the heat penetrates into the fat layer, and you're able to mobilize those toxins and sweat them out during the sauna. So we include, it's part of our treatment. We have all our patients do infrared sauna. That's a great question. Do you guys have any other questions?
You can also type here if you would like to schedule your free 15-minute conversation about the functional medicine. So it's an introductory call, and I will reply to you privately and try to schedule something.
So yes, if you don't want to discuss anything here in an open forum, if you don't want to type your questions here, if you want more information on treatment, not only for fibromyalgia, but for any chronic illness, you can reach Sophia at info@vitalitymedny.com, and she will get back to you. If you have any questions, or if you want to schedule the free 15-minute call, to talk about your issues and to see if, we'd be able to help you, please do so. So we're going to keep it open for questions. Does anybody else have any questions? Well, then we're going to wrap it up. Thank you so much for joining us. Thank you for taking your time out of your day to join us to learn a little bit more about fibromyalgia and functional medicine. Please do reach out to either myself or Sophia if you have any questions, or if you'd like to, have your 15-minute call to discuss your medical issues. And please look for us on social media. We're on Vitality Medicines on Facebook and Instagram. We post a lot of educational videos. I also have my own Facebook and Instagram where I post educational videos. So please, keep your eyes open. There will be more webinars and videos in the future. Thank you so much for joining us, everyone.
Thank you, Dr. Alexis, for taking the time to give such great information. And thank you, everyone, for joining.
Thank you, Sophia. Good night, everyone.
Good night.